You're not alone. So many women have this problem, and some people don't talk about these things with their friends. Some women are more open than others. And so you may not realize how many people around you actually have this same issue. Don't let it hold you back. Don't let it start to dictate your life, and treat it while it's early, when it's more easy to treat. Welcome to LifeSculpt by Christi, MD, the podcast where we delve into the art of living your best life. I'm your host, Dr. Christi, a board-certified surgeon, wellness enthusiast, author of the BioVitality Blueprint, and your guide to transforming health and happiness. Here we explore cutting-edge health trends, chat with inspiring guests, and share practical tips to sculpt the life you've always dreamed of. So grab your headphones, get comfortable, and let's dive into today's episode. Today, we're going to talk about all things related to urogynecology. And I'm going to answer some common questions that patients will ask me, or that I will see on my YouTube channel that women are asking about their bladder health. One of the top ones that we'll start with is, why do I leak when I cough and sneeze? Why do I leak when I try to exercise? It's so frustrating when you are trying to exercise, you're trying to take care of yourself, and yet you leak. And so it's very discouraging. And patients will tell me that they modify their exercise. Sometimes they stop exercising because the leakage is so bad or embarrassing. They're wearing pads that are uncomfortable and chafing. It's really working against a healthy lifestyle. So I'm going to break it down for you. Why do we leak when we sneeze, cough, or exercise? So the mechanism that's going on there is a lack of control at the sphincter level. So the bladder is a receptacle. The kidneys make urine, and the bladder stores it until such time that we can go to the toilet and use the bathroom when we're ready. And what holds in the urine until we're ready is an intact sphincter mechanism. The sphincter mechanism consists of muscles that hold the urethra tight. The urethra is the little stem that comes from the bladder that the urine flows through. Muscles surround that urethra, the center of it, and squeeze it shut. And that's what the Kegels exercises are. When you exercise your pelvic floor muscles, you're working those muscles and keeping them strong so that you can hold in the urine. The other part of the sphincter is called the internal sphincter, and it's muscles within the urethra. So we've got the external sphincter outside of the urethra, and the internal sphincter, which is in the wall of the urethra, where the muscles are squeezing involuntarily. You can't really control those muscles, but they're holding it in. Then there's other factors that are involved, such as the condition of the urethra, where if the urethra is thinned out from, let's say, menopause, lack of hormones, then the urethra won't have the same integrity. It won't have enough tissue there to hold the urine in. And then finally, there's some collagen, connective tissue surrounding that area that holds the urethra up in position where the muscles can grip it. So if you're watching me on video, I'm going to demonstrate roughly just with my hands kind of what is going on there. So if you imagine that this is your bladder here, and I'm holding out my fist, and then if this is the urethra where the urine is flowing through, right? So whenever your bladder squeezes up here, the urine comes out the urethra. So there is the pelvic floor muscles and connective tissue that's holding this up in place. And then whenever you cough or sneeze, those muscles will all involuntarily squeeze and hold that shut and increase the pressure there. So when we exercise, cough, or sneeze, there's automatically pressure pushing down on our bladder, and the muscles and connective tissue have to do their job to hold the urine in. So if they are not strong, if either the muscles aren't strong, we haven't worked on them, or they got stretched out from childbirth or aging, or if we have gone through menopause and we did not get any hormonal treatment, the condition of the tissues is not good, then that mechanism to squeeze the urethra shut will not work. And that's when we will get leakage. Now, when I do a physical exam, I will check for this as much as possible just on a physical exam. So I or my team or any urogynecologist or a lot of urologists that treat this condition and gynecologists will look at the condition of the vaginal walls, first of all, especially if someone is after menopause or if they've been on hormones for a long time, been on birth control pills for a long time. We'll look to see if the vaginal walls are thinned out. And that could be one of the potential causes of leakage, um, and could indicate something going on with the condition of the urethra. So the urethra and the bladder are very sensitive to estrogen, and they don't they don't like it when they don't get fed estrogen. So it's very important to keep your estrogen levels up if you've gone through any hormonal changes. Then we'll look at the position of the bladder and the urethra and look for what is called a prolapse or a dropped bladder. And so the connective tissue holding the bladder, holding the urethra in place gets stretched out. That collagen is just kind of like the wrinkles on my face that are pulling everything down. That same thing's happening where the collagen in the vaginal wall and the surrounding connective tissue is not strong. So the urethra starts to swing, it gets real loose, and it does that. The muscles can't grip it the way that they used to because the urethra is swinging away from the muscles. That's called hypermobility. And then finally, looking at the muscles. And so kind of assessing the muscles the best that you can. It's sort of a rough subjective measurement of just having the patient squeeze their vagina around your fingers that are in the vagina to check for strength and see how strong are the pelvic floor muscles. Can they engage them? So some women completely lose the ability to feel the muscles, to engage them. Nothing. There is absolutely zero control over those muscles. Either they got really stretched out, they got neglected, or there's other reasons why they could just be really weak. Um, and so we'll assess all of that to try to determine what's going to be the best thing to help this patient. So if someone now I'm going to go into treatment for this stress incontinence that I'm talking about. And I want to just take a second to distinguish it from urge incontinence, which is also extremely bothersome. In some ways, it can be even more bothersome because it's just more loss of urine, can be more unpredictable. And it's basically a bladder spasm where the bladder just is squeezing so hard that the muscles, the connective tissue don't have a chance because the bladder is spasming. It's just pushing the urine out. You could just be standing there, you could just be washing your hands or trying to get in the door from going to the store and it just releases. And that's more nerve related, typically muscle spasm of the bladder, but not the sphincter mechanism around the urethra. So if we're diagnosed with stress incontinence, then we do the examination, we determine, okay, what is going to be the best course of action? So sometimes if the incontinence is caught early enough, then we can treat it with estrogen can help. Vaginal lasers can help without having to undergo surgery. And that's if we see that the vaginal walls are very thinned out. Then the estrogen cream or peripheral, replacing estrogen in your whole body can really help to build up the integrity of those tissues. If the muscles are weak, then we can try a course of pelvic floor therapy. We can teach you how to do the Kegels exercises on your own. We can send you to physical therapy, or we can do advanced treatments like the Emsella chair, which is electromagnetic chair that you sit on fully clothed, and it's going to tone up your pelvic floor for you, which is really nice. It kind of makes it really easy, and it'll do 10,000 Kegels, simulate 10,000 Kegels in 30 minutes. So it'll do more than what you could do on your own, and it's much quicker than doing physical therapy. So that's if the muscles are very weak. And then if there's a lot of movement, there's a lot of different issues going on, if the leakage is severe enough and none of that has worked, then we will look at surgery, and we can do either a sling surgery for this, or we can do a bulking procedure, which is kind of like filler in the urinary tract. And they have their pros and cons. I've got other videos where I talk about the different treatment options. And but it is very curable, especially if you catch it early. So I always am really happy when patients come in and they're just kind of just started leaking, maybe like in the last year. It's not terrible. Maybe they're not even wearing pads all the time. They just change their panties if they need to, or wearing a panty liner. We're going to have a much better success rate. If it is left untreated, the condition of the urethra is going to get worse, the muscles are going to get worse, and then it becomes much more difficult to treat, and the bladder starts to get spastic, and it sort of becomes a compounding issue. So it's really great when patients do come in early enough and we can treat it. If you have this kind of leakage, work on Kegels on your own. There's a lot of good resources. There's some really cool tools that you can get online to help you build up your pelvic floor muscles. You can try to modify your fluid intake, but you got to stay hydrated too. So it's really frustrating because like there's the bulking procedure, the insurance companies will not cover it unless the patient has tried restricting fluids and doing less exercise, which makes really not a lot of good health sense for the long run. But um, you know, it's kind of I won't get on that tangent of what insurance companies require sometimes. But so you can try some modifications. Maybe if you're drinking a lot of caffeine, that might be kind of making it harder for your bladder to hold. Work on your Kegels exercises. Look into trying hormones. Talk to your gynecologist about that. And if that doesn't work, then come see a urogynecologist, a urologist, or maybe even some gynecologists that will treat this condition. And don't be afraid of the surgery. It's way easier than you think. You 90 At least 95% of the patients, that's what I tell my patients, 95%, but I think it's even higher. I think it's more like 98, 99% of my patients never need a catheter. People are scared that I'm going to need a catheter. I'm going to have a catheter bag if I do this surgery. No, you do not need it. It's really, really rare that one of our patients needs a catheter. And patients go through it pretty easily. It's very minimal discomfort. You would think surgery on that part of your body would be really uncomfortable, and it's usually really well tolerated with minimal discomfort. And patients can get back to normal pretty quickly, and then have a really great success rate. The success rate with these surgeries is up in the high 90s, and there's some durability with it. With the bulking, it's not as much. It'll get absorbed over time, but with the sling, I mean, we have a 17-year study showing that it's still successful in 85% of the patients. So really great options. And you're not alone. So many women have this problem, and some people don't talk about these things with their friends. Some women are more open than others. And so you may not realize how many people around you actually have this same issue. Don't let it hold you back. Don't let it start to dictate your life, and treat it while it's early, when it's more easy to treat. I hope that helps you understand why you're going through this challenge with your health and gives you a little bit of encouragement. And if you're in the Houston area, I'd love to meet you and help you. You can give me a call, give my office a call at LifeSculpt by Christi MD. And let me know in the comments if you have any questions or how this video may have impacted you. And you may help another woman to improve her life and her health. Thank you for tuning into this episode of LifeSculpt by Christi MD. I hope you found our conversation as inspiring and enlightening as I did. If you enjoyed today's episode, please be sure to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us reach more listeners and spread the message of living a life sculpted by health and happiness. Don't forget to follow us on social media at LifeSculpt by Christi MD for more updates, behind-the-scenes content, and to join our amazing community. And follow my personal account at Love Life Medicine for more great health and inspirational content. Until next time, remember to prioritize your well-being and keep sculpting the life you love. And make sure that you get to know God. He truly wants you to know Him and to thrive and have inner peace.